Matthew.
And this is the Handoff Report, the podcast about the cool stuff nurses learn in nursing school and why it matters.
So what are we talking about today? Med administration?
Yes, today we are talking about medication administration.
This is a big one.
Yes, it's one of the first things you learn in nursing school. It is the proper way to give a drug in the hospital setting, or in a home health setting, or in like a nursing home.
Legally giving drugs.
Giving them legally. But I think the biggest thing is giving them in a way where you minimize the chance of making mistakes. The biggest thing, the biggest mistake, and probably one of the most common mistakes in hospitals is drug mistakes.
Yes.
There's entire litigation processes and protocols for what to do when what's called a med error happens. And now here's the tricky thing about med errors. If a doctor prescribes a medication and it's wrong, and then the nurse gives it because the doctor ordered it, right? And something happens to the patient, then it's the nurse's fault.
And why is that? It's
the nurse's fault because, presumably, nurses should know better.
So we're like the last line of defense.
Exactly. We're the last thing. That's fair to some extent.
Oh yeah.
Because we are taught pharmacology. We are taught which drugs are good and bad for which illnesses. And so when a doctor prescribes something, we're supposed to have enough foresight, right? Is that the right word?
That's the word.
Yeah, we're supposed to have enough foresight to see how something like this could go wrong. And if we have a hunch like that, but just give it anyway, then we're not really protecting the patient at that point. You're just taking chances.
That's not good practice.
And there is protocol for when a doctor prescribes something and the nurse doesn't want to give it, but then the doctor insists anyway. There is protocol to protect yourself as a nurse in those kinds of situations.
It's a collaborative environment, or at least it should be.
Exactly.
And that's what advances best practice.
The first thing to talk about is that there's something called the 6 rights of medication administration. We're going to go through them. The first one is the right patient.
This one feels kind of self-explanatory.
The right patient talks about how it's very important to double check and triple check that you're giving the medication to the right person. This is the part in nursing school where they really drill into you to be like, hi, can you give me your name and date of birth?
2 patient identifiers.
2 patient identifiers. That way you are not giving it to the wrong person. And we hear horror stories about this every time where, because nurses are given 6 or 7 patients, they have a really hard time keeping them straight. The next one is right time. Part of a prescription is that it needs to be given at a certain time. Time can mean either give this IV infusion over an hour, or give this pill every 6 hours. And time can be very important, especially in things like pain management, where if you're not giving those on time, then of course the patient's going to be constantly bugging you about their pain. When you can avoid that by just making sure you're giving the drugs at the right time.
And another important aspect to time is that some drugs interact with one another. So they're timed in a way where you give them in an order, or you give them with enough spacing in between them so they don't interact with one another.
A common example of that would be if someone is due for Tums, but Tums interacts with a lot of other medications. So usually you would have to plan your day so that you give them Tums 30 minutes before or after their other medications. The next one of the 6 rights is right dose. How much of the med are you supposed to give? So this is not something, there are maybe 1 or 2 meds where nurses memorize what a safe dose is, but most of the time you kind of gain that through experience. If you work in a pediatric floor versus the emergency department, you kind of have a more instinctual understanding of, hey, that's like a lot of Keppra, or that is a lot of antibiotic.
Yeah, you get to know the meds that are on your floor, like the big ones that you use, and then the other ones. I mean, the great thing about it, if you don't know what it is, you just look it up.
Yeah, that's the thing. If it's new to you, it is your duty to look it up. Do not get in the habit of giving a medication you don't know about. Even if it delays your day a little bit, it's for the patient's sake that you take 5 minutes to read up on the side effects and the basic teaching points for this drug that you haven't given before. And, be disciplined that way. Not because you have OCD, but because the patient's life could be at stake, right? So the right dose is how much you give. Anytime a mistake is made there, it has to be documented.
Mm-hmm.
The next one is the right route. Route means where and how you give the medication. For example, you can give opioids in a lot of different ways, or antibiotics you can give in a lot of different ways. You can give an antibiotic as an oral pill, or you can give an antibiotic as an IV injection. So you have to double check which way is correct. If someone can't swallow, maybe because they had a stroke, then maybe the best thing for them might not be a pill. And if the doctor prescribes a pill, it'd be probably a good idea for the nurse to check if the doctor can re-prescribe it as maybe a liquid or an IV injection. That way we're not putting the patient's safety at risk by forcing them to try to swallow a pill.
In a pediatric setting, you'll get the routes a lot. You have to change them because you might have a kid who needs a medication and it's oral and it's like a liquid suspension type of deal. So you give it to them and then they won't take it after that because it's yucky. So you have to change the route to a route that you can give it to them and they'll take it. So there's that little wrinkle.
Oh yeah, because they might get a little fussy about not liking a med. Yeah.
Yeah, it'll taste
like a med. Yeah. So after right route, the fifth one is right med. Right med talks about making sure you grab the right med. Before, a pharmacist would dispense, like a human pharmacist would dispense medications to everyone on the unit. Now they have these machines called Pyxis. And a Pyxis, I think, is great because of how it reduces the potential for error. Because you basically sign in with your employee information, basically, and the Pyxis will pull up all of your patients only, which is awesome. And then per patient, it'll only pull up the meds that are prescribed for that patient, which again is great. But once you select the meds to draw and you draw them out, whoever restocked the Pyxis machine might have made a mistake. And I've seen that more than 5 times.
Oh yeah. The future is now, but it still kind of sucks.
So you still have to double check. The Pyxis is cool because it automatically opens drawers and cabinets for you one by one so that you're not trying to grab like multiple drugs at a time.
It takes your hand and it walks you through it.
Absolutely. When it says like section 8 of this drawer and you look in section 8, you take the drug out and you read the label with the dosage and compare it with what's on the screen. Because multiple times I've taken it out and it's twice the dose, or it's a drug that looks like another drug.
Or it's a totally different drug that you have no idea why it should be in that bin.
There's a drug called cephalexin and a drug called cefepime, and both of them I think are white powders in a vial. So I distinctly remember like picking one up and realizing, oh, wait a minute, this looks like the drug I want, but it's not what the label says. So that's your duty as a nurse to double check that kind of stuff. And then the last one is right documentation. This is important because you need to document accurately what you give to a patient, whether you made a mistake or not, because that way, if something happens, people can look back and know that you gave it in the first place, and they know exactly what you did, so people can find what went wrong. If something happens to the patient and they look back and you have pristine documentation, oh, you gave all the meds the way you're supposed to, that's how you kind of cover yourself. And that's a good thing.
Yeah.
Now, if people look back and something wrong happened to the patient, people look in your chart and you did not document that you gave a drug, but you know you gave it, but you didn't document it, then legally speaking, you didn't give it because you didn't write it down.
And I mean, the odds are that, down the road, if something were to come up, you might not even remember what happened. So it's important to be able to show by your charting a story, and like a story that you can follow and understand, and everyone else can as well. So you can, in a way, prove, I did this, I did this, I did this, I did all the things I was supposed to. So it is really a way to protect yourself, and and also to protect the patient.
Yeah. Documentation also includes, you can describe, the way Matthew said, it's a story. You can describe how the patient tolerated it and whether they refused it or not. You can write about the doctor being like, yeah, the consulted with doctor. You want a most accurate depiction of what happened as possible.
And you want to show that you were proactive in thinking through things. And
so those are the 6 rights: the right patient, the right time, the right dose, the right route, the right medication, and the right documentation. So in school, they tell us that the best practice is to check these 6 things at least 3 times before giving them to the patient. And there's these 3 critical moments where you do that. Nowadays, documentation software and the Pyxis really work together to try to force you to do these 3 checks. Even if they force you to do it, you have to be thinking in your head, have I checked myself, or am I just clicking through these meds, right? These 3 times are when you first receive the order, when you go get the med, and then when you give the med to the patient. Those are these 3 moments where you need to kind of check the 6 rights. So when the order first pops up, or if you get a phone call with an order, you have to compare it to what the patient's medication record states. So you might look at it and be like, is that the same thing as what's written in the order sheet? You look at it, and if it's the same patient, same time, same dose, same everything, then that was your first check. Next, you're going to go get the med. And when you get the med, you're going to compare it to those same 6 things. Is this the right med? Is this the right route? Is this the right dose? All of that stuff. Well, yeah, one mistake I almost made, and I'm ashamed to say I didn't catch it. My nurse caught it. The hardest thing to read in the Pyxis is how much of the drug to take. I'm constantly squinting at the screen wondering, am I supposed to take 2 vials or 1 vial? Because what I accidentally did was I was pulling out all these medications, and I was supposed to give 2 aspirin, but I only got out 1.
Oh.
So I made it all the way to the bedside. But yeah, so there you go. You check it 3 times, but it's that 3rd time where you catch your mistake. Well, in my case, I was just about to keep going because I thought I was hot stuff, just like going through this med administration like a pro.
You
but my
probably
nurse
wearing
was like,
joggers that day, weren't you?
Okay, yes. But my nurse was like, hey, you don't have enough of the aspirin. You need 2 of those pills. That's what's on the order.
I must have given you a headache.
No, he was nice about it because these nurses all remember the time they first made a med error with much wincing.
Be kind to your pharmacists.
Yes.
They're people too, you know?
So we had to march our way back to the Pyxis and get out another aspirin. And
walk of shame, huh?
Yeah, and then we had to write down like, why were we getting aspirin again? Because to the machine we already got the 2, but we had to go back and say like, did not initially get enough or something. And so yeah, even though the mistake was caught, you still write it down somewhere that like, oh, forgot to get a second one, but we got it and gave it, That way, nothing can be accused of you, Another story is one of my nursing instructors. The reason she so adamantly made us research our meds before giving them and to be so careful with our meds was because she almost killed a patient her first day on the job. She was a brand new nurse in the ICU, and the doctor had ordered a fluid bolus, which means, you kind of hang a bag of salt water basically, and you're supposed to give it quickly to rehydrate the patient. When she first was a nurse, all bags of fluid looked very similar. They all were clear, the same size, and they all had black ink. All the labels on them were in black ink. She had inadvertently grabbed a bag of potassium chloride instead of a bag of normal saline. Now, potassium chloride yes. Potassium chloride given quickly is what they do to patients on death row. When people are executed nowadays, they are put under with anesthesia and then given potassium really quickly. And that's how people are. So she was about to do the very same thing to a patient, and she watched the medication go through the tubing. Something in her was gnawing, like, is this the right drug? To her, just something was off, but she watched that medication almost make it into the patient's arm. But then she stopped it, looked at the bag, and realized she was about to give potassium chloride. And she immediately disconnected everything in a panic and then got the right drug and started giving it. But then she had to ask for a break because she was so in shock, You know that panic that sends you into fight or flight when you kind of nearly hit someone on the road? There's this period afterward where your heart's still racing and you can't think straight.
Right before I was going to take a pharm exam. Yeah. I know the feeling.
That's what's called a near miss. That's like an actual term. You're supposed to document whenever you make a mistake, but also whenever you almost make a mistake, because a near miss is not supposed to incriminate you. This isn't supposed to shame you. Documenting a near miss tells researchers, hey, this is where people are constantly almost making mistakes. Maybe there's a way we can kind of change how things are done so that this stops becoming a near miss, which I think is awesome.
Yeah, that's pretty cool.
And because unfortunately that was a common near miss, now dangerous medications like potassium chloride are written with red ink on the clear plastic bag.
Which is also why they test people for color blindness.
Oh, really?
And their new employee.
Oh, is that why they tested us for color blindness?
I think so. I'm kind of making a lot of assumptions here, but...
No. That would make a lot of sense. Huh.
There you go.
I thought it was just because...
they're discriminating against people who can't see certain colors.
I don't know. Yeah.
That'd be ironic, huh?
I think that concludes this episode on medication administration. The point is not to feel discouraged or feel like an idiot, even though that happens a lot when you almost make a mistake or whenever you do make a mistake. Think of it more as you're primarily concerned for the safety of the patient and for the safety of future patients by participating in the improvement of how you give medication.
And it's a safety net, so you should use it.
Mm-hmm. Absolutely. Well, I'm David.
I'm Matthew.
And this is the Handoff Report.